As mask wearing has become more common, the number of new infections have dropped in Multnomah County, at least for 1 week. This is a graphic from the county. The far right side shows the case count for last week. Back to the left are earlier weeks. It's unclear if the 1 week reduction is specifically because of mask wearing or that the earlier weeks were part of a surge of infections connected to the 4th of July. Either way, the virus is widespread in the county, and the weekly infections are way above the 81 needed for kids to return to school in person.
It's going to be incredibly difficult to get that low.
Dr. Jennifer Vines is the top public health doctor for Multnomah County. The county has not been below 81 cases for 3 weeks since the beginning of the pandemic in early March. That's 5 months ago. That's the threshold required by the governor to reopen schools in person.
You can imagine it would be several weeks before we could even come close. And you're right, Pat, that's going to be really tough.
Many Oregon school districts plan to teach online until early November. In Clark County, the situation is not much better. Public Health Director Dr. Alan Melnick supports schools there opening online only in the fall. He said the state is in danger.
Unless we turn this around and unless people physically distance themselves and use face masks, we're at risk of, even though we're affecting more young adults now, we're at really risk of being where Florida is at and having an older population infected, having a higher mortality rate, more deaths, and actually overrunning our hospitals.
More than 7,000 people have died in Florida from the virus. Both Dr. Melnick and Vines believe wearing face coverings will make a difference, along with keeping a safe distance. Dr. Vines does not think closing businesses and ordering everyone to stay home again is necessary in Multnomah County, at least not now.
So far, it doesn't seem to be the businesses that have reopened that are really driving spread. Again, where we definitely see spread is in people's social gatherings.
Both doctors agree. The fastest growing number of cases are with young adults, 20-year-olds. And while they'll probably survive just fine, there's always the danger that they could infect and kill their parents or their grandparents. In Northeast Portland, Pat Dooris, KGW News.